I'm Jane Sinclair, General Manager of Health and Emergency Services with the County of Simcoe, and I'm here with a group from the county as well as some of our finest paramedic services at our award-winning land ambulance station here in the town of Collingwood, with celebrating Paramedic Services Week from May 27th to June 1st. On behalf of all of us here at the County of Simcoe, we want to wish you Happy Paramedic Services Week! Thank you so much for all you do.
The County of Simcoe Paramedic Services is committed to timely, clinically sophisticated emergency response and community strategies that preserve life, improve health, and promote safety. The County of Simcoe Paramedic Services uses different types of paramedics in the field. We have primary care paramedics who undertake rigorous training through 2 years of college, as well as provincial certifications that they must undertake to even be considered for employment. These paramedics employ sophisticated assessment strategies and medical decision-making along with medications and electrical therapies to improve patients' outcomes. The County of Simcoe also employs advanced care paramedics in the field. Advanced care paramedics employ strategies, medications, and tools to manage complex medical patients. All County of Simcoe paramedics are trained to recognize heart attacks when they see them. They undertake medical assessments to identify patients having heart attacks in the field. They can then start treatment immediately as soon as they identify that heart attack. They will take them to the appropriate hospital for the best level of care. This is the gold standard of care for heart attack patients. When paramedics identify patients in the earlier stages of stroke, they can transport them to the regional stroke center, which may not be the closest hospital, but it is the appropriate hospital to give that patient the best chance of an outcome. Time is brain. I would encourage anyone who thinks they are experiencing a heart attack or a stroke to call 911. Paramedics will be there, assess you, begin treatment, and take you to the appropriate hospital. 911 is the call to save you time and save your life. Another response strategy we have here at the County of Simcoe Paramedic Services is the utilization of what we call the IRU, or the Incident Response Unit. The IRU is a cadre of paramedics who have specialized training to manage patients that have been impacted by chemical or hazardous materials emergencies, as well as supporting our allied agencies and police services with tactical police responses. They're there to support the allied agencies, our allied responders, as well as the people they may encounter. Another strategy the County of Simcoe Paramedic Services uses to manage patients is the Community Paramedicine Program. One of the parts of the Community Paramedicine Program is the training of a small number of paramedics to manage patients with chronic medical conditions in their homes. These paramedics will make appointments with these patients, visit with them regularly, and make sure that they stay on top of their health status. The paramedics also engage directly with the physicians of these patients to ensure that the physician, the paramedic, and the patient are all connected in their care plan. The paramedics many times will find patients in an early state of decline and reverse that state of decline before an exacerbation of their condition occurs. This has been proven to reduce 911 calls, emergency department visits, and visits to the doctor. This allows a little bit more capacity in the healthcare system for other people to engage physicians and healthcare providers, and it keeps these patients at home happier and healthier. If you are a person who thinks you may benefit from such a program, talk to your physician and tell them to get in touch with us. Another community strategy the County of Simcoe Paramedic Services utilizes is our public access defibrillation program. You will see across the county at every school and many rinks and arenas and community centers, you will see public access defibrillators on the wall. There's over 600 of these devices spread across the county, and there's thousands of people trained in their use. But you don't have to be trained to use them. If you ever see someone collapse and you don't believe they have a pulse, take the machine off the wall and make the call. Call 911. The real value of the public access defibrillator program is you, people in the community that are willing to use it to save a life. In a sense, anyone in the community can be part of the emergency response team that ends up saving a life. The public access defibrillation program also provides training sessions annually to help people feel comfortable in the use of the public access defibrillators and learn CPR. The County of Simcoe Public Access Defibrillator Program has saved many lives already, and there's many more that will be saved because of people like you. You may see the paramedics on the road responding to calls, but what you probably won't see is what goes on behind the scenes that makes that happen. Paramedics undergo ongoing significant training annually to make sure they stay on top of the trends of new medications and new procedures. There's logistics supports to make sure that we have medications and equipment in good shape, ready to go. We have scheduling specialists, we have administrators, we have investigators in our professional standards units to make sure we have public transparency. There's a lot going on behind the scenes, much like an iceberg. Most of it you don't see, but the operation could not exist without them. In an effort to relieve the demand on the healthcare system, county paramedics are continually looking to evolve and address changes in the environment to keep people outside of the healthcare system as much as possible while ensuring they stay healthy in their homes. Paramedic Services is here with you 365 days a year. We'd love to talk to you. Come up and see us at the community events. Visit simcoe.ca for more information.